So just to start off, today's 265 days later, 38 weeks since March 12th, and we're still going down that path. And one of the things when I get into the numbers, we've said this last week, Dr. Whalen and myself, and we knew they're going to get higher, and they're only going to get higher as we go on. So we're going to talk about that, but a few other things that we learned from the control room. But first and foremost, we had an Albany County resident in his 90s pass away last night. So my condolences and prayers go out to the family, to all the families this has happened to. So now we have 161 residents that have passed away from COVID-19, and to the other 159. It's a difficult time for anyone. And, listen, I know he was in his 90s, but still, he's loved by a lot of people, and it's hard on that family. You know, it doesn't matter what age it is. When you love somebody and you want them in your life, you don't want them taken early. So, again, my prayers and condolences to the family and to the other 160 this happened to. So it makes it tough. We now have 6,038 positive cases of COVID-19. 2,181 people are currently under mandatory quarantine. We have an increase today, another record, unfortunately, and I was hoping our records were done in November, 167 positive cases overnight. So yesterday we had 159 positive cases. Again, we're just unfortunately going to see that number continue to go in that direction, and I guess 100 is going to be the norm where we got to get used to it, look at it, and look at the data differently, which we're trying to do. But on another note, the CDC advisory recommended to healthcare staff and long-term residents and staff at facilities get the vaccine first. The vote was 13-1. Now it goes to the director of the CDC, and they'll make that final decision if that's the route they're going. So when the vaccine rolls out, and it's, I believe, December 10th, we should start seeing it here December 12th getting out, and hopefully the state DOH has a plan with our plan on how we're going to get the vaccine out to everyone. But these are good things, but out of the positive cases we had yesterday, 15 have had close contact to a positive case, 1 reported traveling out of state, 3 are healthcare workers, and 148 don't have a clear source of infection. As of today, 24,085 people now have completed quarantine. 5,134 tested positive for the virus. That's an increase of 163 recoveries since yesterday, which is also good news. The number of residents currently being hospitalized from the virus, again, above yesterday's record. There are now 84 people currently hospitalized from this virus. Yesterday it was 76. So we have 84 today. That's a net increase of 17 new hospitalizations last night. So I want to point back on November 20th, we highlighted the number of residents in the hospital at 45, and that was a record, 45. Now, less than 2 weeks later, we're nearly doubled the number, which is alarming. So I also want to highlight it's not just older residents who are hospitalized. This is a question we get, and we kind of broke it down a little bit, but you can do it on our dashboard too. 13 of those hospitalized between the ages of 25 and 49. So 13 people currently that are Albany County residents are in that age group. 36 are between 50 and 74-year-olds. That's more than half of all the residents who are currently in the hospital. So think about that. Our hospitalization rate is 1.39% of those who have tested positive. Yesterday, that rate was 1.29%. 12 patients are currently in the ICU. Yesterday, the number was 12, and the day before that was 11. Over the last 5 days, there's been an average of 117.6 new positive cases each day. Yesterday, it was 112.2. We continue to monitor the data ahead of the possibility of Albany County or parts of it entering into the microcluster zone. We're still waiting for the state to release more information on a new matrix that they'll be using to decide which areas enter the microzone cluster. So that's one of the things my deputy Dan Lynch is going to talk about. But on our control room meeting yesterday, it was confirmed that the county 7-day% positive average went low enough to reset our 10-day count, which Dan will get into. So we started a new day count November 26th as day 1. Take it from there. It's 10 days. So Governor Cuomo earlier this week announced that he's updating the matrix that would qualify an area for one of the zones. So we had to get all the new data. He put 5 new steps out the day before. We had a control meeting, so we're still waiting on guidance, what it means, how it affects schools, how it affects businesses. It's all changed a little bit, and most of it, and Dan will get into this too, is that they're going to be looking at hospital beds. They're going to be looking at how many hospital beds are available, how many staff are available in them hospitals, and how many are on ventilators and so forth, meaning that's going to go into the new cluster zone. So that even though we're getting record numbers of 168, 159, and so forth, a lot of this new matrix that they're coming out with is going to be based on capacities in hospitals and staff. So that changes it, and it gets a little tricky trying to figure out through the weeds which way we're going, but it kind of helps us not get into them zones, so which is a good thing. So the 7-day rolling average for percent positive rates and numbers of new daily cases per 100,000 residents. The matrix will also now include hospital bed capacities, ICUs, which I said, and the death rate, and available hospital staff of and then sick patients. It's clear. It's still not entirely clear how all these matrix will be used, but from now on, the county is not in a matrix cluster zone, but we are heading in that direction. As I said yesterday, our hospital and ICU bed capacities are in good place. We had a meeting with Dr. Venditti from Albany Med, and talked to our control room yesterday about everything, and I should know that because I've known them. Our kids went to school together. But really got into the capability of Albany Med and the other hospitals that fall in partnerships with Albany Med. So it was good news, and one of the things they did point out is that they're seeing, yes, more patients, more hospitalizations, less people on ventilators, and they don't know if it's the strain of the virus is treating this next round differently than it did 9 months ago. So looking at our percent positive rate, Albany County 7-day rolling average has hit 4.4% using the data from November 30th. That comes after our daily percent positive that went up to 5.4 on Monday. So we'll see the full effects of Thanksgiving as we continue to move forward in the coming days. And ultimately, the best way to protect ourselves from all this is, again, sound like a broken record. Please wear your mask, wash your hands, stay 6 feet apart, and do the right thing. It's going to be a difficult month of December for all of us. But again, we'll get through this. I keep saying this. It's a marathon, not a sprint. And by doing the right thing, it's going to make it easier. The vaccine's around the corner. I know people are fatigued. And one of the clusters that we are seeing, it's not bars and restaurants or gyms as much. It's people having parties at their house, and that's the thing we have to address. But before I get into that, Dan, is there anything you want to say about the zones?
Yeah, thank you, County Executive. Good morning, everyone. So I was on the briefing a week or so ago to discuss the micro-cluster zones, and as you are all aware now, there's been a variation and some change of the metrics that are going to be used to determine the entry into a yellow, orange, or red cluster zone. So I'll talk about that in a moment, but basically just a recap of where we are using the prior metrics, those being the 7-day rolling average of infection rate. And the County Executive mentioned that on November 25th, we had a 7-day rolling average of, I believe, 2.987%. That actually qualified as a reset. So our new count begins on the 26th. So we're in day 5. Our data is as of November 30th at this point. So we're at day 5. We'll wait later today for the data to come in, the test results to come in from the 1st of December. But we're on day 5. But more important within that 5-day window, 2 of the days, the last 2 days of that 5-day count, the 29th and the 30th of November, actually would qualify us for an orange because we're over the 4.0 level for that. So the County Executive over the last several days and weeks has been forwarding a message that it's inevitable if we were to continue to use the metrics that were designed some time ago from the state. Earlier this week, the governor, through his 5-point strategy, has entered new metrics to be folded into the existing, and we're still waiting for guidance on what that actually means and how they how they will become a part of the overall evaluation. But they include regular bed capacity, ICU bed capacity, and staffing, and also death rate. So yesterday in the control room call, Dr. Venditti from Albany Medical Center provided the call members with an update as to what some of those levels look like within the region. He participates in weekly calls with the other hospitals throughout the capital region. I believe that there being 12 hospitals that participate in that call. And from all accounts, it appears that from a capacity level, the hospitals have good capacity in both regular hospitalization beds and also ICU beds. If you look at our dashboard, the state dashboard, it talks about where we currently stand as a region, and we are still in a good place. But today, an increase of 17 admissions in one day certainly should open some folks' eyes. We're moving in the wrong direction. But I can say that the conversation yesterday with the doctor was very insightful. The hospitals are working in unison together to make sure that if there is a surge, they can meet the need for the community as a whole, and certainly the residents of Albany County. So that's just a brief update on where we stand with control room and microcluster. But I did want to highlight a couple other things, and you know, back in April, March and April, and even May, there was an absolute call from the community to provide more opportunities for testing. And we've met that call, but we haven't stopped. And what I want to inform everyone is that daily we are aggressively working with our partners in the community to bring more testing to the community, whether it be rapid or PCRs. And that is a constant call. We are constantly working behind the scenes to increase the number of sites, the number of folks that can administer a test, and overall bring the capacity levels up. And to put things into a little bit of perspective here, we went back and we did just a look at the last 7 days of what the Albany County is averaging for a number of tests daily. And it's leveled off. You know, even with the increased expectation around the Thanksgiving holiday, we're averaging about 2,400 tests daily. There's room for improvement, and we see that, we've identified that, and we're going to continue to do our part in attempting to partner with a number of different folks, hopefully to bring more widespread testing. Really with an effort to bring more widespread rapid testing. There's a need. We're listening to you as residents in the county of some of the issues that are occurring with scheduling and just accessibility of rapid testing, and we're going to do our part and partner with other providers to make sure that we can bring additional testing to the area. County Executive, I'll turn it over to you unless you wanted me to talk about the new CDC guidelines.
No, go ahead. You can talk about the CDC guidelines.
In regards to yesterday, there was news that came out in regards to the CDC guidelines in regards to quarantining, the time necessary to quarantine if you had exposure to an individual with COVID-19, a close contact. So basically they adjusted. It used to be the 14 days. Now it's adjusted. You can test out of it at day 7 with a negative test. You could come out of the quarantine period. If you don't test, it's now 10 days as opposed to the 14. So that certainly helps. It helps employers. It helps parents. It helps right down the line of getting folks back to their normal responsibilities with the day. So I'm sure when Dr. Whalen is back, she'll be able to describe more fully what that means. But I just wanted to highlight that change that came in overnight.
Thank you. And to point that out too, and I'm glad that you did, it's going to rely on the state DOH to do it and the governor, so they have to agree to it. It's just a guidance, so we're hoping that they follow that and go with CDC recommendations. But on a positive note, a couple, things. United Kingdom now is the first country to approve the Pfizer COVID vaccine, and will be distributing it next week, which is good news. So they'll be getting it next week. This is an important moment because we can learn from what they're doing to go forward and what we'd be looking like to go forward ourselves here, and which is good. So we're going to see how they do it next week. And like I said, December 12th is only around the corner for us. I have also been reading about a rapid at-home COVID test that would be being developed by scientists that would be used for those without symptoms, because we get a lot of that too. This could be a game changer as more and more people look to get tested as the virus spreads. So it's too soon to tell if we'll be in the store shelves before the vaccine is widely put out there. But again, it's going to take to probably May, June for us to get the vaccine. You got to figure there's 330 million Americans, and they got only so much vaccine to put out there. So it's going to take time. So it's going to be a rough couple of months, and that's what we want to kind of remind everyone. I've been saying this and saying this. There is light at the end of the tunnel, but we just got to hold fast, and we got to be there for one another, and we'll get through this. So please, by all means, make sure that we continue to do that. We can stop the spread by not having social gathering parties. So one of the things that I was just about to say before the deputy took over is that one of the clusters we are seeing are at people's homes now, more now than ever before, especially now that bars are closed at 10 o'clock. People are having more gathering at their houses, and the problem with that is they're not socially distancing and they're not wearing masks. The other problem is you start drinking and no one's there telling you, like at a restaurant. If you go down to McGarry's, test is on you, enforcing the rules like get that mask on or leave, get that mask on. So we're seeing that because people feel in their comfort zone. Well, I've been with, this guy or this lady for the last 6 months, and I'm okay to be close to them. And then they feel the same way about someone else. It's like that domino effect that I keep talking about, that then they feel comfortable, and then they feel comfortable with someone else. And it only takes one person to do the wrong thing, and you get the super spreader. So we're seeing more of that than anywhere else so far with the clusters that are coming back. So please, if you're going to have people at your house, stay 6 feet apart, do the right thing. I know there's some major holidays around the corner, but look how Halloween and Thanksgiving has set us back, and if it continues down this path, unfortunately, it's only going to get worse before it gets better. But talking about what Dan was saying about testing, we are trying to improve on it. We're trying to get it out there. I actually talked to John McDonald, or actually he reached out to me, I should say, on they want to get together and talk about the vaccine coming out. And certain communities feel they haven't had a say, so they have a say in the community. I think it was Councilmember Joyce Love and Wanda Willingham, the legislator, and Bert Simpson, a bunch of them that want to make sure that they're being heard and how this vaccine is going to come out to the community. So John with Dr. Whalen's going to be having, and Dr. Robinson are going to have a meeting on that and talk about that. But please go to our website. It's available. I know right now dates are packed. I check it myself. I go on and I look, like I said yesterday, I look at Walgreen on Holland Ave, and they have 4 or 5 days down the road. They're booked out. I will say this: please be patient. I know people are arguing. I know the sheriff had to send one of his cars there to one of the places because they were having issues in the lobby. Tensions are up, and it's not that person's fault who's saying no. There's no appointments available today, but there is one 2 days from now. Everyone wants a rapid test. Unfortunately, not everyone's doing it. But if you go to our website, it shows the time. I tell you this: call ahead. Call ahead before you waste your time and drive there and find out you can't get in, and try to make an appointment or do it online through a variety of sources. But you can call the Whitney Young, and we're going to have the testing set up for this Friday, 518-465-4771. We cover the cost. I like to say that, so you don't need insurance. Don't worry about it. Albany, same thing, 1-888-364-3065. And, now you have Price Chopper, CVS, Purdy One, Walgreens, and plenty others which you can choose from that's the closest to you. You have to go on the website and, yes, don't hold the time wait, because it was accurate before we hit this wave before Thanksgiving, and everyone's killing it. So the wait times are really off right now, and I imagine it's probably going to slow down now that people are back from traveling from the holiday. Again, our mental health support line is available, not just for adults, for children. Again, I'll say this: please talk to your kids. Take the time. I don't care if they're 8. I don't care if they're 5 or if they're 18 or 35. The world's different out there. We said this early on. Reimagine what everything's going to look like, and for kids, it's a struggle, and they just don't show it as much sometimes, or they're acting out, or they just need to talk to somebody just to feel some type of connection, or something's not connected right in their world. Reach out to our mental health. That's what it's there for, and for the parents. I can't imagine. I remember I always said one of the biggest prides I had was raising my 2 kids. I have 3, but 2 at the time when I was a fireman, and I had that nice schedule, 1 on and 3 off, and I stayed home with my kids. It was the hardest thing I ever did. I can't imagine being a parent, being home with your kids, trying to educate them now, and still trying to work on top of that. I was stressed out the other way. So, I mean, I can't imagine trying to add all that frustration onto these parents now that are home and trying to teach their kids. And when it comes to math and stuff like that, it's tough. That line's there for you too. And I will say this, please take a walk in your neighborhood, take a break, take a step away. That homework's going to be there, everything is going to be there. But again, we'll get through this together, and we'll see the light at the end of the tunnel. So 211 New York State hotline as always. And please, everyone, just continue to do the right thing. Stay safe out there, wear a mask, cough into your arm, clean your hands, 6 feet apart.